Have you ever stopped to think about the difference between the oxygen that's in your blood versus the oxygen your body can actually use? Because, they're not really the same thing. There's this hidden dynamic relationship that controls how your body gets the oxygen it needs. And the key to understanding all of it is this really elegant S-shaped graph. All right, let's get into it.
So, here's what we're going to cover. We'll start with the big idea. Then, we'll meet the molecules that make it all happen. After that, we're going to decode the story that this S-curve tells. Then, we'll see how the curve can actually shift, figure out why it shifts, and, most importantly, why any of this matters in the real world, from your daily workout to the ICU.
Okay, so here's the crucial thing to get right off the bat. This oxygen dissociation curve, it's not just some static chart in a textbook. No, it's a living, breathing picture of how easily oxygen can get to your tissues. It shows us that your body can literally change the rules of the game for oxygen delivery depending on what it needs, second by second. Now, to really get the curve, we've got to meet the stars of the show. We're talking about the molecule that does all the heavy lifting and the two main ways we actually measure oxygen in our blood.
First up is saturation, or SaO₂. This is that number you see on a pulse oximeter. It's pretty simple. It just tells you what percentage of your hemoglobin is currently carrying oxygen. The best analogy is to think of each hemoglobin molecule as a little four-seater bus. Saturation just tells us, on average, how full those buses are. Are they 98% full, 90% full? That's saturation.
And then we have partial pressure, or PaO₂. Now this is different. This measures the tiny bit of oxygen that's just kind of floating around, dissolved in the blood, not actually on one of those hemoglobin buses. And this is the key. PaO₂ tells us how much oxygen is available. It's like the number of people waiting at the bus stop, ready to get on.
So why is this bus analogy so good? Well, it's because of hemoglobin's superpower, something called cooperativity. See, at first, hemoglobin is in this 10 state. It's a little reluctant to pick up that first passenger. But once the first oxygen molecule hops on, bam, the whole thing changes shape into a relaxed state. This makes it way easier for the second, third, and fourth oxygen to bind. Its affinity, or its stickiness for oxygen, actually goes up the fuller it gets.
So, we've got saturation, how full the bus is, and partial pressure, how many passengers are waiting at the stop. Let's put it all together and see how this incredible relationship plays out on the graph itself.
You see that distinctive S shape? That's no accident. It's the direct result of that cooperative binding we were just talking about. And it perfectly tells the story of oxygen's journey between two totally different places inside your body. Let's start at the top. This flat part, the plateau, is what's happening in your lungs. In your lungs, there's a ton of available oxygen, right? A super high partial pressure. So thanks to cooperativity, hemoglobin's affinity is through the roof. It gets really sticky and just gobbles up oxygen, getting almost 100% saturated. The buses are leaving the station packed full.
But now look what happens here, on this super steep part of the curve. This is what's happening out in your tissues, your muscles, your organs, places that are using up oxygen. So the partial pressure is lower. And here, hemoglobin's affinity just plummets. Just a small drop in available oxygen causes a huge drop in saturation. It's brilliant. It means hemoglobin is rapidly kicking its passengers off the bus exactly where they need to go.
Okay, but here's where it gets even cooler, if you can believe it. This S-curve, it's not set in stone. Your body can actually shift the entire thing to the left or to the right to fine-tune oxygen delivery based on what you need at that exact moment.
The best way to think about this is that hemoglobin has a grip on oxygen. When the curve shifts to the right, it means hemoglobin has a looser grip. It's got a lower affinity, making it way easier to unload oxygen. A shift to the left means it has a tighter grip, a higher affinity, so it holds on to oxygen much more stubbornly. So, for the exact same amount of available oxygen, a right-shifted curve means a lower saturation because more oxygen has already been dropped off. So what is it that tells hemoglobin to loosen or tighten its grip? Well, it's not random. It's this incredibly intelligent response to the chemical environment all around it.
So let's ask the question, what would actually make the curve shift? What conditions would make your body want to deliver oxygen more easily, or maybe hold on to it more tightly? A shift to the right, that looser grip, is caused by things like more carbon dioxide, more acid, and a higher temperature. Now, when does that happen? Think about it. When you exercise, your muscles are pumping out CO2 and lactic acid, and your body temperature goes up. These are all signals that your tissues are working hard and they are screaming for more oxygen right now. And so the curve shifts right, and hemoglobin unloads that oxygen exactly where it's needed most.
And on the flip side, a left shift, that tighter grip, is caused by the exact opposites. Lower CO2, less acid, lower temperatures. And where in the body do you find that environment? You guessed it, the lungs. This is just perfect, because in the lungs, the goal isn't to drop oxygen off. The goal is to grab it and hold on tight for the journey through the body.
Okay, so this is all really amazing physiology. But how does it actually play out in a real person? This is where we connect all these dots and bring it right into the clinic. You know, the really mind-blowing part is that your body is using both shifts all the time. It's like a tale of two tissues. As blood flows through the lungs, the curve is shifted left to grab as much oxygen as possible. Then, as that very same blood gets out to your hard-working muscles, the local environment there shifts the curve to the right to dump that oxygen off. It is an unbelievably efficient delivery system.
But what happens when a disease process throws this whole elegant system completely out of whack? Well, that's when understanding these shifts becomes absolutely critical for taking care of patients.
For example, take a patient with severe acidosis, meaning their blood is way too acidic. This causes a massive right shift. Now hemoglobin's grip is so loose that it can't even pick up oxygen properly in the lungs. The buses are leaving the station half empty. The entire oxygen delivery system starts to break down.
But here's the tricky part. Let's say we have a septic patient who's acidotic. If we try to fix that acidosis too fast, we can accidentally cause a huge left shift. And now, suddenly, hemoglobin has a death grip on oxygen. It refuses to let go, even when it gets to the tissues that are desperate for it. We could end up starving them of oxygen even more. And that kind of brings us to our final thought here. That little oxygen saturation number you see on the monitor, it only tells us how full the bus is. It doesn't tell us a thing about whether any of those passengers are actually getting off at their stop. This curve teaches us that real oxygenation isn't just about supply, it's all about delivery. So, is cranking up the oxygen always the right answer? As we've just seen, the real story is so much more interesting.